Well, it finally seems to be coming to an end. The health aid paycheck crisis, first investigated a month ago by Local 12 News.
Many home health care aides went without pay for as long as 3 months after the state of Ohio changed to a new payment system. But as Local 12 News reporter Jeff Hirsh tells us, some aides were not affected at all.
82-year-old Willa Wright and her home health care aide Theresa Pharris are kind of like a team.
Just like a friend, really what you call a friend.
Try to keep the spirits going, keep them up.
Actually, Pharris does a lot more than that for a client who has diabetes and walks with a cane.
What does she do? She do everything. Just like you seen her doing my hair, she assists me with my back to see that I get in there, get my back and stuff washed. Can't bend down to do my feet. She's here to do that. She makes the bed.
But unlike many other home health care aides in Ohio, Theresa Pharris has not missed a paycheck and is not worried.
No problem. None whatsoever.
Pharris works for a large company, Home Care by Blackstone, with 1,200 aides statewide. Unlike independent providers who work for themselves, the large company has the ability to ride out the troubled start of a new payment system.
In general, we're big supporters of the plan. We expected it to be rocky at the start, and it has been, but we've known about it for 3 years, so we just took time to prepare.
The new system called MyCare Ohio covers patients like Willa Wright who get both Medicare and Medicaid. The state used to pay the aides or their employers directly. Now it's insurance companies.
We're nervous about changing how the system worked because our payment flows were predictable with Medicare and Medicaid. And then to have all that go to insurance companies, we had fair reasons as providers to be nervous because insurance companies and for post-acute providers haven't always been our best friend.
However, Blackstone has now gotten about 80% of what it's owed so far, and in some cases the payments have actually come early. The head of the company says the old system had to change because it was incredibly expensive for taxpayers and bad for the patients too, with no coordination between Medicare and Medicaid.
We actually embraced MyCare Ohio because we saw how broken health care was for this population of what they call the dual eligibles, folks that are on Medicare and Medicaid.
As for Willa Wright and Theresa Pharris, there may be a new system in place, but the old good relationship has not changed a bit.
She makes it very comfortable for me.
Now, Aetna, one of the two insurance companies handling the program in Southwest Ohio, now says all of the backlogged claims have been processed and providers have also been given cash advances if necessary. A company spokesperson also tells us they're working with providers to ensure a regular payment schedule in the future. So it's been a long saga.
Yeah, it sure has. The state seems pretty confident, though, that they've got a decent system in place despite the bugs. Why?
Well, because they believe it's necessary, because like the gentleman said, you couldn't go on doing what they were doing. Now, could they have implemented this better? I think everybody that you talk to says absolutely, but they're pretty much saying long term, once you get the bugs out of it, this is an improvement. But if you're on the receiving end of one of the bugs, you haven't been paid for 3 months, hey, you can say how great it's going to be all you want to. It's terrible for you.
Exactly.
Right?
Thanks, Jeff.
Okay.